Well, hi, everybody, and welcome to NAUI's Dive Team Report. I'm your host, Greg Martin. As recreational divers, we learn early on that the one place you really don't want to see is the inside of a decompression chamber. We're taught to follow our dive tables and stay well within our NDL or no decompression limits, but, and that's a big but, what about if you do? Dick Rutkowski with Hyperbarics International in Key Largo, Florida, knows a little bit about that side of things. Dick, thanks for joining us.
Right.
So, talk to me a little bit about the inside of a chamber.
I was the director of the NOAA Miami Hyperbaric facility. We treated many hundreds of divers over the years. I was also the director of and the owner of a facility in Costa Rica. I was the director and owner of a facility in the Turks and Caicos, and I'm now the director and owner of Hyperbarics International Hyperbaric Facility. And I've been the co-director of the NOAA Physicians course for 33 years, so I've had quite a lot of activity. As far as the inside of the chamber, it depends on the type of patient you're going to be receiving. They can come in on helicopter, they can come in on ambulance, they can come in all different forms of medical problems whatsoever, anything from cerebral arterial gas embolisms to spinal cord hits to joint pain. What we would do is we would normally put these people in the chamber, and we'd start off at a depth of about 60 feet on O2. Everybody thinks, well, you got to go back to the depth that we were diving. See, that's not true. If you were diving 150 feet, you'd still be going to 60 feet on O2 and be treated on one of the Navy oxygen treatment tables. We don't use the hydrostatic pressure component as we used to. We use a concept called Isobaric counter diffusion. The fastest way to get the gas out of bubbles and tissues of your body is oxygen at 60 feet. You probably know that if we put you on surface oxygen after 5 or 6 hours, the inert gas, which is the problem gas, will probably relieve some symptoms. If I put you on oxygen at 10 feet, I can counter diffuse out those bad gases quicker at 10 feet than at the surface, 20 feet quicker than at 10 feet, 30 feet quicker than at 20 feet. So the fastest way, of course, then would be oxygen at 60 feet in the chamber. You got to remember that not all people come out 100%. Bubbles to the body act very much like bullets to the body. They disrupt tissue. So the bullets are usually gone right up front, or the bubbles. But after that, then you're treating an ischemic event, and you may have to keep bringing the patient back to retreat until you repair all the damage that the bullets or the bubbles have done.
So this is part of what you do with Hyperbarics International, is you train people on this, correct?
Yes, sir, right. I've trained over 7,600 people over the last 25 years, and I teach at the postdoctorate level, nurses, a lot of military, medics, and so on, commercial divers. I do one program a month.
So you talked, Dick, about utilizing O2, and another aspect of diving that involves O2 is the introduction of nitrox a number of years back, utilizing higher percentages of O2 in a typical mix. How are you involved in that whole process?
Well, to begin with, the acronym nitrox means any combination of oxygen and nitrogen. The first breath you took when you came into this world was a nitrox mix, 21 oxygen. So what we actually do then is we put a little bit of oxygen on top of air. By putting a little bit of oxygen on top of air, we dilute out the inert gas. It's the inert gas that's the culprit gas. It's the inert gas that causes decompression sickness, causes narcosis, and limits bottom time. So we've been using that for scientific diving for many years. There's two ways to use the nitrox concept. One is for physiology, and the other one is for time. Physiology or time. When you take the time, you're right back equal to air again at another depth. When I retired from the government in 85, I brought the concept out in Key Largo because they were beginning to start to consider sinking wrecks, which would start at the top at 60 feet and go to 132 feet. Well, the two NOAA nitrox mixtures that Dr. Wells came up with, my boss, the director of the NOAA diving program, I was his deputy, were NOAA nitrox 1, a 32 mix from 100 feet to 100 feet. That's the best appropriate mix. From 100 feet to the surface, a 36 mix called NOAA nitrox 2. So when they were going to sink these wrecks, I said, hell, If I put somebody on the wreck in 130 feet and they got bent, they should have legal recourse against me. So I started pushing the nitrox concept, not for time, but for physiology. In other words, if you're going to dive at 130 feet, and I give you a 32 mix, and you use your 21 air tables or 21 computer, your equivalent air depth would be as if you were only at 107 feet. We began teaching recreational divers this concept of using it for physiology. Professionally, we use it for time because at EAD of 107, we could go into the 110-foot Navy air table and we could double our no decompression limit time. Everybody starts saying, well, Rutkowski is the grandfather of nitrox. I am not the grandfather of nitrox. I just brought out what we've been using. Commercial divers been using it. Navy's been using it. Everybody's been using it. But we were the ones that started open circuit demand scuba, and it made it more convenient for the recreational divers. I started the certification program of the International Association of Nitrox and Technical Divers in '91, bringing in a couple of my buddies as partners, and it started to take off. It started to do pretty good.
Well, I would say it's done really quite well. I mean, because now it's an international recognition. A lot of people are taking nitrox classes and learning how to dive with nitrox. Dick, what are some of the misconceptions, though, about nitrox? Is it pretty much that, oh, if I'm doing nitrox, I can dive deeper?
Negative. The oxygen enricher concept is the more oxygen you put in the mix, the shallower you dive, but the longer you can dive. It's not a deep gas mix. So you have to know what you want to do, if you want time or you want physiology.
Let me ask one last question here, Dick. How do you feel that the dive industry has changed, and what do you see maybe for the future of the dive industry?
More and more divers are getting into tech diving tri-mixtures and so on, which is good as long as the training is good and they have a tendency of knowing what they're doing, especially when doing penetration dives on wrecks and so on. It's perfectly safe sport, and the physiology of the gases is growing more and more and more all the time and getting safer and safer. I've even had one of the hospitals complain that they're not getting as many decompression cases as they used to because the people are using these oxygen-rich air mixtures for physiology. So they're less prone to have decompression problems, number one. And as we get older, the more oxygen you can put in your mix, the better physiology you're going to have as an older individual also.
Well, Dick, I want to thank you for your time.
Okay, buddy. See you later then.
If you haven't explored the world of using nitrox or you want more information about it, be sure and check out your local NAUI dive shop and ask about nitrox. And for more information on classes that Dick Rutkowski offers, check out hyperbaricsinternational.com. And that's this episode of NAUI's Dive Team Report. I'm Greg Martin. Thanks for listening. I'll see you underwater.